All right, so I guess we'll go ahead and get started. Just some quick housekeeping things for those of you who have not attended one of my webinars before or who need a reminder. A couple of different things. Number one, I hate having lectures with people. What I really like to do is have conversations with people, and we can even do this in our global setting here. And we do that by allowing you guys to have some back and forth with me. Now, unfortunately, because of the number of people that are on these webinars with me, I can't have people actually talk verbally, even if you have the capability with your computer. And so everybody is on mute who's on the webinar right now. But you do in your little control panel there have the opportunity to um, type in a question to me. So as we're going through the webinar, if I'm talking about something that either I went over too quickly or you have a question about or need further clarification about, just type it right in there. And I promise you, I will respond to it. As soon as you type it in, I see it. And I will respond to it either right then and there, or if I know that it's something I'm going to address later in the webinar, I will do so. And I really do appreciate and look forward to that sort of feedback, and because I want to make sure that I'm answering the questions that are most important for you. Number two is that for those of you who don't know me, my name is Brian Sanderoff, and I am a holistic pharmacist. I call myself a holistic pharmacist. I'm a traditionally trained pharmacist. I used to own my own pharmacy. I actually had two pharmacies in downtown Baltimore once upon a time. And probably about 20 years ago, I started a radio show that was called Your Prescription for Health that I hosted and produced for 18 years. That show originated out of Baltimore and also at times was broadcast on stations out of Washington, D.C. and Los Angeles as well. And on that show, we created a forum to discuss what's known as alternative or complementary medicine. It's different than what I was taught in pharmacy school. It's different with what many of us have grown up with, thinking about health in this country. And basically, what I learned is that these things that we call diseases, especially the chronic diseases that we try to avoid getting as we get older, those things that we call diseases really are not diseases. What they are simply very complicated or convoluted ways that your body's talking to you, or my body's talking to me, telling me or you that there's something wrong. And if we can just listen to what the body's really saying, we can fix those problems and make those problems go away. And so I have a whole host of patients that I work with here in my center in Baltimore that used to be diabetic or osteoporotic or used to have depression or high blood pressure or high cholesterol or cardiovascular disease. And the used to be part is because what we were able to do is listen to what the body was saying, make changes, and the body responded differently. I actually teach a course at Johns Hopkins University in their Odyssey program about a holistic approach to anti-aging. And what I say in that course is that all of the diseases that we get as we grow old are actually the body doing exactly what it's supposed to do based on the influences that we give it from the outside world. And so that's my bent. That's how I look at health, and that's how I try to educate people to look at health as well. And so tonight we're talking about probiotics, which are really good bacteria. And this is one of those foundational issues and one of those foundational concerns of health that really affect so many other things in the body and how the body works, that if you don't fix and or maintain a proper, you know, colony of good bacteria in your gut, all sorts of other function can't happen properly. And so there's a lot of people walking around with autoimmune issues or allergies or gut issues or even cancers that really the root cause is an imbalance of the good bacteria in the gut. A couple facts that I want to point out to make sure that everybody understands, and that, sort of lays the foundation for how important it is to pay attention to this. So number one is that your gut is actually your first brain. There are a couple things that are facts that I have not, I wasn't taught in pharmacy school and medical people aren't taught, but one of those is that there's actually more neurotransmitter activity in your brain, in your stomach, than there is in your brain, in your gut than there is in your brain. And from an evolutionary perspective, it's the gut that developed first, and it really is your first brain. And so we all know of that phrase that says, I had a gut feeling about something. And it should be paid attention to when you have a gut feeling about something, because that's actually your first brain speaking to you. And many of us, I'm sure, have had the experience where we had a gut feeling about something, but we let our second brain override whatever that gut feeling was. And then we look back and said, I had a gut feeling about that guy and I should have listened to that. And so your gut really is your first brain. And the other thing is that a whole world lives within that gut. Now, we have a tendency to think of our gut as part of ourself. And, it is, but it actually is part of the outside world. Your gut, your whole digestive tract, is a tube that runs from your mouth through your body and out. And it's a part of the outside world that you carry with you. Everything that's in that tube is actually part of the outside world, and it doesn't become part of you until it crosses that barrier. So there's a part of the outside world that we carry with us, and there's a whole world that lives within that tube. Part of that world are bacteria, and we call them probiotics, or good bacteria, and they have very important functions in the body that I'll go over, as we go through this discussion. A normal, healthy, functioning adult should have 100 trillion microorganisms living within the gut. That's 10 to the power of 14. That's a tremendous number. And in fact, that is more number of organisms than you have as cells in your body, of every cell in your body combined. And it's also been estimated that there are over 1,000 different species of bacteria that could or should inhabit our gut in a healthy way. So, what is the function of the good bacteria in your gut? Well, there are various functions. Number one is they help with digestion. They play a role with your body's ability to break down food into its smallest parts so that you can absorb and use those parts to build and repair. And again, remember, until something crosses that membrane, it's not actually part of you. So when you eat an apple and you take your bite and you chew it and you swallow it, as digestion starts to happen, that's still part of the outside world. Number two is elimination. Bowel function cannot be normal without these good bacteria, these probiotics within your gut. And in fact, half of the bulk of a normal stool is actually made up of the dead bacteria that's sort of running through their life cycle within your gut. Number three is they help protect against negative things growing in your gut. And so these good bacteria maintain the neighborhood the way it's supposed to be maintained. And they keep bad guys from moving into the neighborhood. And when there's an imbalance of the good bacteria, or you don't have enough of it to protect you, then that's when you start to have things growing in your gut that don't belong there. And I'm talking about negative bacteria, viruses, yeast. And we'll give an example of this in action when the good bacteria, is beat up. Number four is that this good bacteria actually makes certain nutrients for you, including vitamin K. And so people that have an imbalance of the good bacteria don't make and absorb vitamin K as efficiently or as well as they should. And vitamin K, very important nutrient when it comes to heart health, when it comes to immune function, when it comes to structure, bones. So what are the factors that affect the good bacteria that's in your gut? Well, of course, number one, everybody knows this or recognizes this fact, is antibiotics. When you take an antibiotic because you have some sort of infection going on, it kills not just the bacteria that are causing the infection, but all of the bacteria in your body, including the bacteria that are in your gut. And it's very common for people to take an antibiotic, have it wipe out or kill the good bacteria that's in your gut, and have ramifications from that fact. And those ramifications can be constipation or diarrhea, because again, these probiotics play a very important role with elimination. It can be that you get reflux or other digestive issues. Very often, women will end up with some sort of yeast infection, like a vaginal yeast infection after taking an antibiotic. And in fact, in my pharmacy days, when I was standing behind the counter, it was common for women to come in with two prescriptions, one for their antibiotic, or amoxicillin or Keflex or whatever it is that they were taking, and then also one for Monistat or Terazol, because they knew that they were going to get a yeast infection 3 or 4 days later. And the reason that happens is because that antibiotic kills all the good bacteria in the gut, which we're keeping a check on yeast overgrowing, and then the yeast comes out and has a party and shows up somewhere in your body. And that can show up vaginally, it can show up as jock itch, it can show up as athlete's foot, it can show up as chronic sinus infections, which oftentimes are actually yeast. So I have a question for you, and you can do the show of hands here if you want, or you can just do it in your mind. I always ask this question when I'm doing a talk in public, and that is, how many people here have taken an antibiotic over the past couple weeks? And usually if I'm in a room of 100 people, 4 or 5 people will raise their hand. And then I ask a question, and that is, how many people in here have eaten chicken, beef, or had tap water over the past couple weeks? And of course, almost everybody raises their hand. And that's testament to the fact that we get antibiotics and exposure to antibiotics through different ways as well. And all of those people that raised their hand likely had exposure to low levels of antibiotics. And so those of us that eat a typical American diet have exposure to things that beat up the good bacteria that's in the gut as well. Also like to point out that alcohol and caffeine are negative influences on the good bacteria. Stress is a very big negative influence on the good bacteria. And there are certain other prescription medicines that can also cause issues with the good bacteria that's in your gut. So these are all the factors that can make the good bacteria not be there anymore. So here's a question that I often get, and it's interesting to think about, and that is, so where do the good bacteria come from in the first place? And it's really interesting because our body doesn't make these bacteria. We get them from our environment. We can get them from food. We can get them from other exposures in the environment. It's funny because we have a tendency to think of bacteria as being bad, that we automatically assume that if we say bacteria, that it's something that we shouldn't have. And that's not the case at all. This idea of us living in a sterile environment is not a proper idea, and it's not what nature intended for us. Nature intended for us to have constant interaction with the bacteria that are around us all the time. Where do we first get our probiotics? What is the very first thing that happens that starts to set up our gut with the growth of these good bacteria? Well, that's exposure to mom when we're born. And what nature intended was for us to be born a very specific way, to come into this world through a specific pathway. And when we have a vaginal birth, we pick up bacteria from mom. That's the very beginning of setting up the good bacteria that's in our gut. And studies have shown that babies that are born by cesarean section don't have the same bacteria in their gut, and oftentimes have a harder time with allergies, with immune function, with gut function, with digestion. And I'm not saying that we shouldn't have C-sections. The truth is that one of my children wouldn't be here today if there wasn't such a thing as emergency C-section. But we oftentimes are resorting to having C-sections when it's not really necessary. We either do it out of convenience or in being overzealous with our surgical interventions. And there's an important reason not to. Same thing with nursing. When a baby nurses from mom, baby picks up bacteria from mom's skin. And when we bottle feed, you're using a sterile nipple. And nature didn't intend for moms to have sterile nipples. And so babies that are nursed have an easier time maintaining their good bacteria. And that shows up later in life as well. One of the reasons why babies that are nursed have better intelligence, higher IQs, less allergies, better immune function, less attention deficit issues, is because of setting up the good bacteria that's in the gut. Now, again, if you have a baby and that baby needs to be born by C-section, doesn't mean that all is lost. It just means that we may have to be a little bit more aggressive in replacing the good bacteria at first and paying attention to that. I also just want to point out that there's one other negative factor that we're finding out with foods in setting up or maintaining the good bacteria that's in the gut, and that is the what are called frankenfoods. And so that's what they call them in Europe. And so there is the advent now of genetically modified organisms. And so there are ways that we are monkeying with the seeds of plants that end up being our food, like corn and soy, that make them more resistant to pesticides or whatever. But what we're also finding is that those foods actually affect the good bacteria in the gut as well. And that's a huge, huge mistake. And as I was speaking the other night about this as well, I just saw some interesting information that the first genetically modified animal is now about to be put into the wild. FDA is taking comment on this fact right now before they approve it, but they're calling this the frankenfish, and it's actually a salmon that has been genetically modified so that it grows bigger faster. And there are some computer people who ran models of what is going to happen in the wild when we add these frankenfish to the environment. And there was one model that showed that if you took 3 of these fish and put them into a population of 40,000 normal salmon, that within 40 generations of those salmon, all of those original salmon would be completely gone, and all of the fish that survived would be frankenfish. And that's really a problem. That really is something that needs to be paid attention to. So, anyways, for this discussion, though, the GMO soy and corn, and right now estimates are that 70 to 80% of soy and corn and corn products and soy products that you see in the supermarket actually come from genetically modified crops. And so I'm talking about corn oil, all the corn ways that we use corn sweeteners, and the same thing with soy. And so if you're using foods like that, you want to make sure that those things say non-GMO if you want to maintain your, the bacteria in your gut. I also want to point out there's such a thing as called, let me tell you about the appendix first of all. So when I was in pharmacy school, we were taught that the appendix, which is this little thing right at the end of the part of the colon there, the large colon or large intestine, sorry, is evolution was making not needed anymore. In other words, science couldn't figure out what it was for, and so we just assumed that it just doesn't have a purpose anymore. And of course, in practice, in medicine, oftentimes people lose their appendix for no reason at all. If you happen to be opened up for some sort of other surgery, something's going on with your gallbladder, or you have a uterine issue or whatever, while we have you open, we're just going to snip this out because, at some point, it's going to cause a problem in the future. And so we might as well just get rid of it. It doesn't have a purpose anyways. Well, nothing could be further from the truth. It actually has a very important purpose. And that purpose is it acts as a reservoir of good bacteria to help to reinoculate your gut when there's an imbalance. And I have often found with my patients that the ones that do not have their appendix anymore have a harder time maintaining the good bacteria in their gut and have more of a tendency to have issues related to that, whether that's digestive issues or constipation or immune function issues that are related to lack or imbalance of good bacteria. So I think that's pretty important. I also want to point out that there's such a thing as called prebiotics. And what these are basically the nutrients or ingredients or substances that we need to maintain an environment that the bacteria can grow in easier. So they're called prebiotics. They'll go by names of inulin or oligofructose. The sources of that would be chicory root or Jerusalem artichoke, plantain. And so lots of times within products, you will see a probiotic product that has inulin in it or chicory root in it, because they're also trying to give the gut the proper environment so that the bacteria will live appropriately within your gut. So what are the health effects of probiotics? This is the meat of the discussion today, and this is really the important thing to pay attention to. So when I put this chart up here, I really want you to take a look at it. And I'm going to go over it, but I really want you to take a look at it and understand. And I also want to remind everybody again, especially for people that just jumped on, I see that we had a couple of people that jumped on over the past couple minutes, that on your control panel there's a question box. And so If you have a question about something that I'm saying, or there's something that I didn't cover that you want covered, please type it in that box. I see it right away, and I will respond to it. Um, I always tell people when I do a talk, I hate doing talks. I don't give lectures. I like to have conversations with people. So I want you to be part of that conversation as well. Okay, so here you are. So under the heading of immune function, the health effects of probiotics or good bacteria, and again, there are studies that support every one of these, claims or ideas. Allergies, cancer, cold and flu, autoimmune diseases, yeast infections. All of these are affected and or controlled by the good bacteria that's within your gut. Cold and flu. Boy, that's topical. This time of year, you can't turn on the TV and see a news report without them scaring you about how the flu is awful this year, and you got to take your shot, and you got to do this, and you got to do that, and blah blah blah. And really, if you would just get your good bacteria in balance, you would find that you are much better protected. The 70% of immunity happens within your gut. And it can't happen properly without the good bacteria being there. The major way that you interact with your environment is through your gut. As I told you, you carry around a part of the world with you everywhere you go. And there's a constant interaction there. And the good bacteria play a very important role with the immune system functioning properly. And there are studies showing that people that have imbalances have tendencies more towards certain kinds of cancers and allergies. And I had talked about the yeast infections. There's a whole bunch of things that have the potential to grow in your gut. And so you need to keep the neighborhood properly populated with the good stuff so that the bad guys can't live there. Brain function, very, very important. And again, more neurotransmitter activity happens in the gut than happens in the brain. And that is sort of testament to this idea that there is constant communication going on between the brain and the gut. And it makes perfect sense because, again, this is the major way that you interact with your environment, with the outside world. And so, how does that information get transferred to your brain? Well, it gets transferred through your touch, it gets transferred through your eyes, all of your senses, and it gets transferred in a very unique and keen way from your gut. And so, when we talk about attention issues, when we talk about all sorts of brain chemistry imbalances, whether we're talking about depression or anxiety, gut function and the probiotics, the good bacteria in your gut, play a role with this as well. Bowel function, constipation, and diarrhea. Both of those can be indications of an imbalance of good bacteria. And oftentimes, when I have patients that come in with that sort of problem, we're able to see that recently in their history, they've been on an antibiotic or have some other reason to suspect an imbalance of good bacteria. And we give them a probiotic formula, and it re-inoculates the gut with the good stuff, and bowel function normalizes, whether it's constipation or diarrhea. And there are people who have chronic constipation. I have patients who have spent their entire adult lives with constipation without understanding why, because they eat a good diet and blah, blah, blah. And as we go through their history, we find out that when they were teenagers, they had acne. And the doctor put them on antibiotics for 3 years to take care of that acne. And that antibiotic beat up the good bacteria that's in the gut, and they never recovered from it. And once we are effective at replacing that good bacteria, all sorts of things change with them health-wise. Irritable bowel syndrome, colitis, Crohn's, that whole continuum of gut issues, very, very important to evaluate the good bacteria in the gut as well. And I put leaky gut there as well. That's something that I've discussed here on my webinars in the past, and it's really something important to understand. Leaky gut happens partly because of an imbalance of the good bacteria, and all of the things that can result from leaky gut, which is pretty much any chronic disease that you could have. I'm talking about immune function, migraines, blood pressure, diabetes, cholesterol, heart disease, allergies, food allergies. All those things are affected by this and can be reversed with attention to the good bacteria. I also put heart function here because the good bacteria plays a role with your cholesterol levels, with your blood pressure, and with how your body handles sugar and insulin resistance, which ultimately leads to obesity. And that's probably the biggest risk factor that you can think of for chronic disease and how your body, is going to age, if that makes sense. So that's a lot of health effects of these probiotics, these simple things. Even kidney stones are affected by the good bacteria that's in your gut. Oxalic acid, which is the most common culprit of having kidney stones, excess oxalic acid, is can be mitigated by the good bacteria that's in your gut and can accumulate when you don't have the proper balance. And so there are times when people have chronic kidney stones, and that's where it's important to evaluate what's going on in the gut as well. So how do we replace the good bacteria? Well, there's a couple different ways to do that. One is with foods, because again, we get these from our environment, and so you can get them from food, and they're generally fermented foods. And so you're talking about things like cheese or yogurt or kefir. Dairy products have a propensity to um, harbor these good bacteria. So that's why you see lots of sources that way. But there's other sources as well, like sauerkraut or miso, soy. Soy foods, generally tofu kinds of foods are fermented. Um, Someone asked me the other night when I did this webinar, is beer? Well, technically, yes, beer is fermented and is a source of those good bacteria, but the good bacteria don't survive well in an acidic environment, of which alcohol is. And so, if you want to try to convince me that the reason you drink beer is to maintain the good balance of good bacteria in your gut, I won't argue with you too much. And then you can also do it with supplements. And oftentimes, what I've found is that we can't get enough of these good bacteria from food alone, and especially when we have an imbalance. I mean, it may be that eating those sorts of foods helps maintain, but when there's an imbalance, when there's already a problem, it's through supplements that you have to be more aggressive to be able to fix those problems. And so I'm going to talk about the supplements a little bit, and how to determine a well formulated product, and so to help make choices for what you're doing. So the question becomes, and this becomes a pretty heavy duty scientific question, is how do we maintain the viability of bacteria in supplement form? These are live bacteria, and what do we do to keep them alive in a capsule or tablet or powder or whatever form you're using, from the time it's made to the time it gets to you? And this is a significant problem. So number one is I want to talk about the potency. You will see probiotics, or you should see probiotic products listing potency as um, billions of bacteria or colony forming units. CFUs sometimes is how you see it. You shouldn't see them as milligrams. And I see those on products sometimes, and they don't mean anything. 25 or 250 milligrams of a probiotic doesn't in any way tell you what's in there and whether it's viable or not. It's not helpful. So you want to see it designated as billions of either bacteria or CFUs, again, colony forming units. You also want to pay attention to the formula of the bacteria that's in there, because again, there are literally hundreds and hundreds of different strains that play a role either as inhabitants or as in transient visitors through your gut. And so taking a formula that only has one bacteria in it is usually not as helpful as it could be. And the formulas that we use most often are ones that have 7 or 8 different bacteria in it. They have names like acidophilus and bifidus and plantarum, and there's all sorts of different long chemical names. I'm not sure how important it is for you to know specifically what those names are. Just that, there are different formulas out there, and you want a multi-strain formula. And then the other thing is that how is it viable? What maintains its viability in your, in that product? And that is a significant problem. Now, oftentimes you'll see products that need to be or require refrigeration, and it's through refrigeration that the bacteria sort of go dormant and don't live out their life cycle and die while they're sitting inside that capsule or tablet or whatever. And that is one way to go, although my experience is that that becomes pretty inconvenient because out of sight, out of mind. And so when that bottle is in the fridge, it's really easy to not remember to take your dosages instead of having it sit on the counter where where your other supplements are. And so I like ones that are shelf stable. And what that means is that they maintain their viability, they stay alive while they're in that form, even without refrigeration. And the there are certain products out there. You have to be very careful about how they're listed, because if you look on a label of a product, it may say, let's say, 10 billion bacteria. And what it really means is 10 billion bacteria at time of manufacture. And by time that product makes it from the manufacturer to the wholesaler to the retailer to you, oftentimes there's nothing alive in those capsules anymore. And so a properly designated product will say X amount of bacteria at time of expiration, which means that they're guaranteeing that those bacteria are viable and will stay alive until it expires. And so the product that I use in my practice and use personally is by a company called Healthy Origins. And I always joke with them about it. They're very creative in the naming of their products. Their product is called Probiotic. And what it is a multi-strain formula, 6 or 7 bacteria. There are 30 billion bacteria per capsule, and it's completely shelf stable, meaning that 30 billion is guaranteed until time of expiration. And the bottle I have in my hand right now expires in 10 of the year 2014. And so that will last for a year and a half and be viable. And I back that up with my clinical experience, because I use this product with many, many patients, and we see results from using this product. And so the other really good thing about this is that it's fairly inexpensive. A bottle of 60, I think we retail for $20 or $19.95 or something. And so it's a very affordable product as well. Dosages, typical dose would be 1 a day. I take 1 of those guys every morning. Everybody around here in my building where we work and out on the streets is getting sick, and we aren't, because we're maintaining, 1, our vitamin D levels, and 2, we get our sleep and our rest, and we don't get stressed, and we maintain the good bacteria that's in our gut as well. If there's a reason that you have an imbalance, you've taken an antibiotic or you're showing symptoms of an imbalance, then we want to be more aggressive. And there are times when, I'll have people take 2 or 3 a day for an extended period of time until things are where they should be, and then we will back that off. There's also a product called Probiotic 225, which is a powder that has 225 billion bacteria per capsule, and I mean per powder, per satchel. And that we will use in harder cases, and or when it's called for to be more aggressive. That's made by a different company. So now, as I'm wrapping up, now's a good time to type in any of those questions that you may have. If I didn't cover anything, I must have done an excellent job, because I haven't had any questions yet. So must have been clear and concise, but I'm sure there's some questions out there. So, I did a talk a while ago about the essential 6, the 6 supplements and/or systems in the body that need to be supported, and probiotics, and taking a probiotic every day was one of those 6, and all of the reasons that you heard me talk about today are why. So here's a question from Deborah. Says, where can you buy the Healthy Origins? I mean, that's a brand that you will find around. You will find it in maybe some local health food stores, depending on where you are, Deborah. Or you can just go online and search for it. We're very, very aggressive with that pricing. And so we sell the bottle of 60, I think, for $20, and we sell the bottle of 150 for 45, I think. So save a couple dollars that way. And I'm pretty sure that's 50% off of the Healthy Origins suggested retail. We're very aggressive with the pricing of those products, and so you can just go right to the website and go to the shopping cart and type in probiotic, and you can read all about it. Thanks for the call. I appreciate that. We have a question from Diane that says, what was the name of the probiotic that you recommended? Again, called Probiotic by the company Healthy Origins. And if you've never taken a probiotic and you suffer from any one of those things that I talked about, digestive issues, reflux, constant constipation or diarrhea, brain fog, immune dysfunction, and or you've been exposed to antibiotics, try taking a probiotic daily for a month or 2 and see the kind of results that happen from that. The way I like to explain it is this. There are times when in our society we've bought into the idea that as we age, it is acceptable to lose function. And so maybe you get into your 30s or your 40s or your 50s, and maybe particularly when you hit some of those, um, milestone birthdays that make us feel worse, maybe as we're aging, and things start to change. Our energy's down a little bit, and maybe, we don't sleep as well, or maybe memory and focus isn't as good, or digestion isn't used as good as it used to be, where, you used to be able to eat spicy foods and now you can't anymore. It may be that all it is an imbalance of good bacteria. And if you take a probiotic, you may start to see those things reverse. And there are often times when I work with people that, they come in for a specific problem and we treat it. And we treat it with, our tools here that we use, our supplements and, lifestyle changes or whatever, including probiotics. And invariably, I'll get a call back in 2 weeks from one of my patients. And um, the patient will say, I didn't tell you about such and such, but this got better also. And that's sort of evidence that there are these, underlying issues that are affecting function that we don't really realize. And so I'm a real big proponent of trying something for a couple months and then sitting down and saying, is there value in doing this? Do I feel better? So now I got some questions from Suze. One of them says, let's say a person is sick with a cold. Would you suggest they up the dosage of the probiotic from 1 today to 2 per day? And if so, for how long? Yes, I do recommend that. And how long would be while you're sick and maybe for a couple weeks afterwards. So if you wake up one morning and you're starting to get cold or flu, or maybe even, just a little scratchy throat, but people at work are getting sick, start to increase your probiotic, do it for a couple weeks. Once you've been in the clear and you feel great, do it for another week, and then you can cut back to where you were, if that makes sense. And then also Suze says, losing function is not an option. Become a well-being. I really appreciate that. I'm going to write that down. That should be one of our taglines. Suze, thank you. I appreciate that. So let me just point out that I do these webinars every month. This is the schedule that's coming up for the next 3 months. I'm going to be talking about fats and, the importance of fats and how to use fats in your diet, which fats to cook with, and, what they really mean. That's in February. and March, I'm going to be talking about reflux and GERD, and how in medicine we really are not very good about fixing that problem. All we're doing is turning down the symptom. In April, thoughts for food. And I thought I want to talk about the way that the food industry hides things or alters things. One of the things that the food industry started to do a while ago was they changed the size of a serving. So because they know people are looking at those labels and they're worried about calories and fat and sugar. And so instead of making a change in the food, they just make a change in the serving size. So that way those numbers look less, and you don't realize that. The most recent thing that is disturbing to me is that they're starting to add components to food that change or alter the function of your taste buds. And so foods that are normally bitter that people, don't want to eat, they're now starting to put in there things that make the bitter receptors on your tongue not register bitter anymore. And the kicker is they don't even have to be labeled. So you could be eating foods like that and you don't even realize it. And that's awful. So I'm going to do a whole webinar about that. Said another question from Deborah, and that was, what about all the drinks they promote on TV? Do they work? Talking about like Dan Active and that kind of thing. They do have good bacteria in there, but not nearly enough to be able to really re-inoculate your gut with the good stuff. They're just not potent enough. And their viability, we have some questions about as well. And then lastly, I'm not the biggest fan of dairy in the world, honestly. And so oftentimes using dairy can cause other problems as well. And then I also want to point out to everybody that we have our archives. And so I've been doing these webinars for about 1.5 years now, at least monthly. And so we have a nice catalog of, probably 15 or 16 different webinars on cholesterol and stress and osteoporosis and depression and menopause and the flu. There's a really good one on the flu that is, that I did last year. And now's a good time to listen to that again. Vitamin D, good night's sleep, other things like that. And including this one, which will make it up onto the archive probably by the beginning of next week. So everybody, thank you so much for joining me. I really do appreciate it. I can't tell you how much I appreciate your interest in your own health, your trust in me. Please do not hesitate to get in touch with me either through the website, by emailing me, or giving me a call. It's wellbeinggps.com. And I really look forward to you guys joining me again. And I'm seeing people type in thank you, and I say you are very, very welcome. Everybody, have a great afternoon or day.